Dedham, Boston, broadcasting live from Hyde Park. We are Boston's new home for classic R&B and hip-hop. Urban Heat 98.1 FM and 1410 AM. The views, thoughts, and opinions expressed on this show are those of the host, guests, and callers and are not necessarily those of WZBR, its management, affiliates, and advertisers. WZBR and the Urban Heat holds no responsibility for the validity and/or accuracy of information on this show.
Hi, I'm drkerryann, and I understand the importance of Black mental health. That's why I decided to start my own show on the Urban Heat, Black Mental Health Matters. Join me on Sundays at 1 p.m., where we will discuss interesting topics and meet experts in Black mental health. Let's talk about the mental health issues facing our community. Listen online at heat981fm.com or download the app 98.1 FM, the Urban Heat. See you then. Hello, everyone, and welcome back to Black Mental Health Matters. I'm Dr. Carrie-Ann Williams, a psychiatrist practicing right here in Massachusetts, and this is a talk show about all things related to mental wellness in the Black community. So if you'd like to participate throughout the show, you can call in 617-238-7111. We're also streaming live on Facebook on the page heat981fm.com. So thanks for joining us today for Black Mental Health Matters. And guys, you all know that I'm a fan of alternative ways to boost our mental health, not as a replacement for, but in addition to individual therapy and, when indicated, medications. Now, today is the first in a two-part series on music therapy. And so today I have two wonderful guests with me today, Dr. Adeniki Webb and Dr. Natasha Thomas. So let me introduce them to you. Dr. Adeniki Webb is a board-certified music therapist with over 15 years of experience working in inpatient and outpatient behavioral health settings with children, adolescents, and adults. She received her undergraduate training in music therapy at Radford University and completed her master's and PhD in music therapy at Temple University. Her clinical experiences working with people from Black and Brown communities led to her focusing on developing cultural awareness and responsivity in music therapy practice and education. Dr. Webb currently serves as an assistant director of the Arts and Quality of Life Research Center at Temple University, where she is also an adjunct faculty. She's a founding member of the Black Music Therapy Network, and she is a co-host of the podcast, Black Creative Healing. And let me introduce Natasha Thomas Phd. She is a board-certified music therapist and an assistant professor at Indiana University, Purdue University at Indianapolis, IUPUI. She serves on the steering committee of the Black Music Therapists Network and co-facilitates the podcast, Black Creative Healing, with Dr. Webb. Dr. Thomas also serves with, she's also serving with Marisol Norris as a co-editor of an upcoming special issue from the Journal of Music Therapy on Equity and Justice. She's a committed advocate for creative and culturally sustaining support for marginalized communities. Her current research focus involves Black creativity, particularly identity construction and community care. Dr. Thomas's research and clinical work are inclusive of emerging technology, as well as the perspectives of disability and queer identities, and the unique ways that those perspectives and resources can intersect to impact quality of life, identity construction, and meaning making. So welcome to the show, Dr. Webb and Dr. Thomas.
Thank you. Pleasure to be here.
I'm so excited to have you guys here. I've always been so interested in music therapy. I love music, and I feel like it's an underutilized strategy for kind of working with our emotions and helping to uplift our lives and our kind of our daily habits. I guess I wanted to start off with clarifying what exactly music therapy is. And I don't know which one of you want to start with that. Dr. Webb, would you like to start with what is music therapy?
Sure. And in full transparency, my definition of music therapy changes maybe every 6 months, every year, especially depending on if I'm working with a new group of people. Mm. So if you were to go to the American Music Therapy Association's website, which is musictherapy.org, they will give you a wonderful little definition about music therapy is the use of music and music-based strategies by a trained clinician to affect well-being in all these different domains. And that is like the simplest we can get to describe such a broad range of practices. For me, having worked primarily in behavioral health, looking at people with emotional and behavioral disorders, and working with kids through older adults, it has shifted a little bit. So I think of music therapy as using music and music-based experiences to create opportunities for people to explore wellness in different domains as it is meaningful to them. So different people working, say, in different settings might focus on physical health with music. In my work, I have focused on emotional and cognitive health. So we have focused on looking at how people can feel better in themselves, like developing positive self-image, or self-concept, working on finding coping strategies for difficult emotions such as anger, dealing with depression and those sorts of things. And the way I've used music with them to do that would differ from how someone working in physical rehab as a music therapist would. So I think it's really context specific, but at the gist of it, if you want to be simplistic with the definition rather, I think it's about using music to address areas to support wellness across different areas of functioning.
Anything to add, Dr. Thomas? Go ahead.
No, I was going to say that about covers it. I'm similar to Dr. Webb in that my definition shifts over time based on who I'm working with and where I'm working. And I'm frequently telling my students, sometimes it might look like a full circle moment, but it's really a spiral. It's a constant deepening of my relationship with music and my relationship with constructs like healing and community. Yeah.
So you're using music to help support a person's goals for their own healing, their own emotional wellness.
Yes.
And so I imagine that if a person goes into to start music therapy, that's probably the top of the discussion is, what are their goals?
Yeah. What are your priorities? Where do you come from? What are the things that hold meaning for you? I think that's part of why music therapy can be so effective, where other therapies might struggle a little bit, is that I will have youth tell me things in the context of their favorite song, in the context of their favorite artist, and the ways in which they relate to that artist and the music that person creates, that they would never tell their regular therapist, or they would never mention in group therapy, but they'll talk about it in music therapy. So I just think music therapy is such an amplification, particularly in Black and Brown communities, of the ways that music is already part of our lifeblood. It's already so deeply ingrained in all of us.
Yeah, I was going to mention that as well, but go ahead, Dr. Webb.
No, I was just going to jump in because I was thinking about, it's the relationship. It's wonderful to say someone wants to come in to address different goals that apply to their healing. And someone might think, well, maybe I can do that on my own. Like if I use this song to support this way of feeling, or that song or writing songs to do this aspect of well-being. But there's the part of the therapist, the relationship that is formed with the therapist through the music sort of helps further that. Because I think about, just like you were saying, Dr. Thomas, when I've worked with adolescents, they wouldn't say things to the psychiatrist or to the social worker, but they would say things to me. And I think it was the music, but also the relationship that they formed with me because of the music, So I think the music gave me an in that some of the other therapists didn't have. But then I could have been a mean person on top of it, and then they still wouldn't have connected with me.
Right.
But because of the music and me and stuff, we were able to start exploring things together in ways that were working them towards their healing.
Yeah, that's so crucial. Thank you for that, that addendum, because music therapists are frequently part of a team. They're part of the treatment team. And so the things that get shared in the context of music therapy are part of the overall treatment plan often for participants. So that's a incredibly important point to make as well. Yeah.
And I imagine it's fairly just kind of disarming for the person because, as a physician, when I walk into the room, people think, oh, you have an agenda. You want to give me medication.
Yeah.
Or the therapist walks into the room and they think, you're going to try to make me talk.
Yes.
But the music therapist walks in, they're like, what what should I expect here? Are we're gonna listen to music? What's gonna happen? And so it kind of I feel like it is an advantage, as Dr. Webb says, is that they may tell you things that they don't tell other people because it's they don't have some of that loading of like what to expect. They come in and maybe a little bit more open-minded as well, and they get to talk about things that they like and just how they feel.
It's really funny. I think back to some of the groups I've had when I was working inpatient in a behavioral health hospital. So let's say I've been working with maybe 6 adolescents and I've seen them twice, and the 7th one comes in as their first time. So the 7th one is kind of sitting off to the side watching the other 6 do stuff. And I talk to the 7th and I say, would you like to try this instrument? No, I'm good. But they're watching the other 6 drumming, or they're watching the other 6 write a song. And you can almost see physically their body starts leaning a little bit closer. They might change their sheets. And then what I usually ended with my groups with was I'll pull out this big book of like songs that we could sing and play as a band. Or if we didn't feel like singing, we could pull them up on my iPod. And it was fascinating to watch the 7th person all of a sudden, like, you got this song, you got that song. And then they're like all into it. I want to hear this song. I want to sing this song. And then the next time we meet, number 7 is front and center, trying to play instruments, trying to sing. So it's interesting to see how the music environment lowers inhibitions in some ways. Like, after people kind of feel it out and they say, well, oh, this is not necessarily a threat. This is just a different way of kind of expressing myself.
Right.
Then they start to get into it.
And then they're developing relationships with their peers too. That's the piece that always gets me so excited, is that, they're coming in, they're doing their own internal healing work, but they're also building these relationships with their peers that then ideally will generalize to relationships outside of that therapeutic space. And so, I worked at an adolescent treatment facility where some of the staff would joke when it was time for a participant to be discharged, they'd say, okay, I never want to see you again. And that sort of is the nature of what therapy is, that you are training them to eventually leave you. But hopefully when they do, they will have developed tools that they can integrate into their everyday lives. And especially with music being so everywhere, it's what a great tool to give someone to take with them, as they go. Yeah.
Wow. It's, we had kind of spoken about how sometimes we kind of, I guess, walk into it even accidentally, certain music, certain songs that represent what's going on in the world, or represent what we're feeling inside, and we just connect to those songs and play them over and over. Kind of being able to harness that and use that intentionally as a therapist, I imagine then that in your training, the questions to ask, how to kind of guide without directing completely, so that they are able to kind of think about what the music means to them.
Yeah. I'll often set up experiences that way. For instance, there's a group that I co-facilitate with some students in my music therapy program where it sort of starts off as like a general music listening space. Like, where's your head at today? Bring a song that sort of represents where your head is at. And I already know that I'm going to bring a song too, and that there are questions that I can preload into the song that I'm bringing to say, hey, I want you to listen out for this thing. Let me know if you hear this theme come through, and how you feel like that weaves into the experiences that the artist is describing. And then now we've got sort of this opening ground for conversations to start to spill into. But yeah, the more you do it, I'm sure Dr. Webb can attest to this too, the more you do it, the easier it starts to become to see those little threads and just sort of like pull them out. You just get better and better at it.
Yeah, so what Dr. Thomas is describing is like an activity, for lack of a better word, or experience that we do call like song lyric discussion.
Yeah.
Where you play the song and the group members or the individual listens to it, and you discuss what kinds of themes or matters are there. And it's always fascinating to me to see how people engage with the song. Like, especially if there's something. So I used to use song lyric discussion very often when I co-facilitated a group with a nurse on the unit I was on. So every Tuesday and Thursday, we'd have like a supportive group therapy. And on Thursdays, I'd bring in a song. And the kids always started getting interesting. Oh, what song are we going to do? What song are we going to do? And these were the same kids who on Tuesday wouldn't want to talk about their difficulties with their mom, wouldn't want to talk about the anxiety or depression that they have. But here, let me play this song about this artist who seems to be talking about life is terrible, but I'm going to try to get through it this way. And you say, well, what do you think the artist is going through? And out comes, well, he must be having difficulty with his mom because, this sounds like a problem you would have with your parent. Like, oh, really? And then they can start exploring their experience after you go. Like, it's a safe, I know there's a psychoanalytical term for it, but like, I guess maybe it's a safe transitional object. I don't know if that's the word I'm looking for, where you can sort of project onto the music.
Yes. Yeah.
Like a displacement.
Yeah. And then start to see how it relates to you afterwards, And like Dr. Thomas says, after you use that experience, that method frequently, you start to see, well, this is the angle I need to take with this song and with this group, because I can use a song with one group of adolescents that may not work the same way with another group of adolescents. Even if both groups are dealing with anxiety or dealing with depression, it's not going to come out or be received the same way. So it's really interesting to see how I've got to look at it and think about it.
Yeah, and that's a good moment too to say as a translational thing for parents out there. The last guest we're talking about parenting. If you're hearing your youth listening to music that you're like, that sounds so depressing, or that sounds so angry, that's a window into how your youth is feeling, and they're using the music to, as Dr. Webb said, to project or to place their feelings in that safe container so that they don't go run that energy out in destructive ways. So often pop culture sort of tells us that if they're listening to destructive music, they're going to do destructive things, when science, research actually tells us the opposite of that, that the music is a safe container so they don't go out and do all this destructive stuff. So you can utilize that, you can leverage that to have healthy conversations with your youth about what they're feeling and experiencing.
Wow. And it's so interesting because I think that in many ways, using the arts in mental health often uses this displacement with music, with theater or drama therapy, with actual art of drawing, painting. A lot of it is kind of displacing, so the person can safely experience their emotions in a non-threatening way, in a way that doesn't feel like it's overwhelming for them. They can still process it without being overwhelmed, which is really, really I think just an amazing thing. And it's sometimes teenagers will say things like, "Are you trying to trick me?" That
is the thing.
Well, kind of, a little bit.
A little bit. We actually had this was in my dissertation study that I did with youth, looking at the way that they built relationships with each other and with the music as they were sort of constructing these pieces to represent their identity. And it was a participatory action study, so the youth were aware that sessions, I mean, ideally, you always want your participants to know sessions are being recorded, that there are notes being taken and that sort of thing. But every week we would also show them, here's what was said last week, and can you help us clarify if this is what you meant or something like that. And I remember in one of the first sessions, and I mentioned this in my dissertation too, one of the youth said, "You a whole stalker," and shut down. And we had a moment where we had to rebuild some trust, because I don't know if that youth had forgotten or if they didn't realize how much of what they said was going to be sort of shown to them. But that is a trust building thing. That comes with, the training that we have as therapists to help us be able to say, yes, we're keeping records of things that you say, and those things are part of your treatment, that we are talking to other members of your treatment team. But this is a relationship. You have a say in how those conversations go. You have power and agency here. And so I think the more that we can strengthen that trust grows to the point that they can know that we're having these other conversations, or that we may be bringing in some things that may be challenging, but they know that it's all in community with us, it's in relationship with us, and that there's trust and agency there.
So thank you. And so for those of you that are just joining, you're listening to Black Mental Health Matters. I'm Dr. Drkerryann Williams. And today I'm talking about music therapy. And my guests today are Dr. Thomas and Dr. Webb. And if you guys have questions, if you want to call in, the phone number here is 617-238-7111. That's 617-238-7111. We're also streaming live on Facebook, and that's on the page heat981fm.com. So we do have a question from Facebook user Paulette. And she says, this is very interesting. Is music therapy covered by insurance?
Ooh.
That's a good question. You want to start with this one?
I can try. I think it depends on where you are.
Yeah.
And what's going on. So for example, say you or someone you like, one of your loved ones was in a hospital setting and they were referred to music therapy. Music therapy would be covered under it would be reimbursed under whatever insurance covers that hospital stay, whether it's a behavioral health hospital or a medical hospital.
Mm.
If you're talking about seeking music therapy privately, it depends on your state and it depends on your plan.
Mm-hmm.
Unfortunately, not many places recognize music therapy. Not many insurance companies have recognized music therapy as a service they would pay for. Some insurance companies will allow you to get reimbursement for it if you pay out of pocket and then submit, submit your claim. But I'm not sure if some of those plans require you to have been referred by a physician. So say a psychiatrist or a psychologist even referred you to a music therapist and you have that as part of your claim. So we're still working on advocating with different states in general in terms of getting that awareness of it being an essential service and advocating with insurance companies. So I don't know if Dr. Thomas can say a little bit more about that.
It's like Dr. Webb said, every state is different. So like I'm in Indiana and they have music therapy on the autism waiver. So if you're working with someone who's on the autism spectrum, who's qualified for services under there, you can get those services reimbursed. And in general, it's a good idea if you go to musictherapy.org or the Certification Board for Music Therapists website, cbmt.org. You can find a therapist near you, and if you reach out to that therapist, they can usually tell you what they've had success with in terms of where they are and what companies they've been able to get successful reimbursement with. So it's always worth a shot. You never know. When I was living in North Dakota and thought for sure nobody's going to reimburse music therapy in North Dakota. And I did manage to get some reimbursement there. So it never hurts to ask your therapist, but every state is different.
Do we have a sense of like the range of out-of-pocket cost? That probably is geographical as well, but
right. And it also depends on if the therapist is working with a facility or in private practice. Private practice can sometimes be a little bit pricier because the therapist is having to, do all of their own budgeting and taxes and stuff like that. But going through agencies can sometimes be a little bit more affordable. Is it kind of
comparable to maybe individual therapy? Individual therapy can run in the hundreds, the 200s, for an hour out of pocket.
I'd say most places it might be cheaper than that.
Okay, so maybe less than 100?
Yeah, maybe sometimes you can find less than 100, but again, it's so geographically dependent.
Okay. So less than 100, I might be doable for some folks,
right?
But then more difficult for others.
Yeah.
And is it? I guess I'll kind of launch in a little bit about whether it's a kind of thing that's a time-limited therapy. Is it something that you can say, well, I can commit to this for 3 months, something like that, so you can budget for it. Would you say that that's kind of the format?
Therapists are flexible. Yeah.
And I think it depends on what brings the person to therapy too.
Right.
So say like say somebody came to music therapy because of grief, right? That we might not be able to say in 3 months we will have successfully addressed all your issues with grief. What we could say is that in 3 months we can reevaluate and see if we need to continue or not. But if it's something like let's say somebody was dealing with something stress related or anxiety related, that could be something where we can say perhaps after 12 weeks of treatment, you might have learned sufficient coping skills that we can evaluate and determine, 3 months was a good part, you can move on. So I think it kind of depends on the needs that people have too.
Yeah.
So walk us through a typical music therapy session. How does it work? What does it kind of look like?
Oh my goodness, that's almost as diverse as this. But what I love about it though is usually if you speak to the therapist and you get an assessment set up, the assessment will sort of give you some insight into what the therapy might look like. So I don't know if maybe, Dr. Webb, we can each talk about like some of the places we serve and how they're those places. Yeah.
Sure. So at the risk of being simplistic again, all the sessions I've done had like beginning, middle, end. There's some form of greeting, then there's like the meat of the session, and there's some form of closing ritual. So with the kids, and when I worked with adults who had dementia, we'd have like a greeting song. Because I think for people, as for some people, it's really helpful to have that transition from whatever you were doing into music that marks off this is a special time. And then if it's the same ritual or song each time, they come to expect it and it orients them. And for people with dementia, for example, it's good to have something orienting all the time. So we do that. Often when I worked with the kids and adolescents, after I did the hello song, but with the adolescents, I did drumming more often than not. I found drumming was a great way to assess where the group was, like how energetic do they feel, how cohesive are they, how willing are they to make music, or do they need to take in music, you know, and kind of talk differently about it. And with the adolescents and adults, I'd often present it as like, you know, we can use music in different ways to get what we need. So we can use music to show how we feel, change how we feel, or keep us where we are if we're kind of in a great spot. So what do you think you need the music to do for you today? And then they would say something. And even if somebody says, change how I feel or stay where I am, so I get two different responses, we can still talk about, well, okay, there are different ways we can make music, or we can listen to music. And then there's a whole range of things we can do within that can help you change your mood, or that can keep your mood where it is. And is flexible enough that one person, two people doing the same experience can get different things out of it. You know, so then, you know, we have the greeting ritual. We decide upon what we're going to do with the music, because I think it always makes sense, even if I have something in my back pocket, that I find out what the group wants to do, what makes sense, that it meets their needs in the moment. So we'll do that. Sometimes the group might decide it's about songwriting. We need to let a lot of stuff out. You know, we need to put it together and we want to make a song. Sometimes the group might decide, you know, it's been a rough week and we really need something to uplift us. We want to hear music that makes us feel encouraged, music that makes us feel inspired. So then we create a playlist of songs that we might listen to or sing through or something like that. And then, you know, we have moments of discussion, and it's an interesting balance. How much do you talk? How much do you just let the music do its thing? And after that, there'll be some kind of closing ritual. With the kids and adults who had dementia, it would be a song that I would close with. With the adults and adolescents, it was more like a summary of what happened in the group, and maybe something they want to say they can take from today's group that they can hold on to. And I usually try to shorten it, like just give me one word he can take from today, or one phrase that you can take with you as you go into the next thing. So that's pretty much how I've done my sessions.
Yeah, and my group sessions look a lot like that as well. It's such a great, you summed it up so well, Dr. Webb. that formula of opening and closing rituals with the sort of meat of the session involving, you know, frequent negotiation and renegotiation with the participants is very much a part of how I do things as well. Some extra elements that can sometimes come into play. I have some groups now that I'm facilitating that involve both synchronous and asynchronous models of engagement. So for instance, there's a group that we run with a youth facility that has a Discord channel. Actually a whole Discord server that's set up to sort of mimic the physical facility that we used to have sessions at. So there are different channels for the different quote unquote rooms in the building. And so there's a music therapy channel that's in the music and multi-faith room. And so on our music therapy days, we'll frequently, you know, type into the channel, hey, music therapy's happening. Here's the Zoom link. We're going to be here live. But in between our sessions, we're posting infographics and journaling prompts and encouraging discussion ongoing throughout the week with the youth that hop on the server. So the server's open between 3 p.m. and 9 p.m. And there are volunteers there all the time. And my music therapy students are assigned to engage at least twice a week in between sessions. And so we have that sort of asynchronous model of engagement. That's all part of the music therapy relationship that we're building with those participants too. So that's one extra model that music therapy can sometimes take, especially now during the pandemic. But another model is one that I used to work with the School for the Blind in North Dakota. And part of my job was working with students when they would come to the campus of the School for the Blind. And so I was teaching adapted lessons using Braille music. But then another part of my job involved driving to the homes of children who were medically complicated or had so many needs that they could not come to campus. And so there would be days where I would drive up to a house and a parent or a staff would come out and say, you know, today's probably not a good day for music therapy. This kid has been really, it's a high pain day. They're really just distressed. I don't think you're going to get anything productive. And I would say, well, we don't have to work on our physical therapy goals today. We can just, are you okay if I just come in and maybe we just play a little bit of music and see if we can get them to rest? You know, and so I would come in and I'd take out my guitar and there would be no opening, closing, nothing. It would just be, let me just start playing something and improvising vocally and trying to find a way to match musically where this child is at. If they're crying, maybe I'm going to start making some crying sounds too. And if you're standing on the outside, that might look a little weird. But what happens is eventually that child starts to recognize someone's here with me. Someone is relating to what I'm experiencing, and they start to quiet just so they can hear what you're doing. And then you can start to quiet too. And gradually, you might find that musically and just generally auditorially, things will start to get softer and more relaxed to the point that eventually this child falls asleep. And so those moments can be really magical too, because then the care that has been provided and the relationship that has been strengthened is not just between you and that child, it's between you and that child's parent, you and that child's staff. And everything is deepened in that moment, that everyone gets a chance to rest and feel nourished and rejuvenated. And then they can go in and we can do all of the like physical therapy stretches and the vision exercises and all of that another day. You know, so sometimes music therapy can look like that too.
Wow. Yeah. It's like, as you described, it's almost like you're kind of on the same frequency, like the same wavelength.
Yeah, it very much seems that way.
So, which is going to kind of segue into my next question. But if anybody's just joining us, you're listening to Black Mental Health Matters. I'm drkerryann Williams, a psychiatrist here in Massachusetts. And today we're talking about music therapy. And I have Dr. Thomas and Dr. Webb, who are board certified music therapists. And they're talking a little bit about what music therapy is and what a session looks like and why it can be a really helpful complement for our mental health. If you want to call in with any questions or comments, you can do so at 617-238-7111. That's 617-238-7111. And we're also streaming live on Facebook. The page is heat981fm.com. So you can follow along there, or drop a question or a comment. Or just if you just want to see what we look like, you can go to Facebook. So check us out there. So this kind of segues me into the question of how music affects our brains. You know, I always think about, as a kind of like a little bit of the scientist in me is kind of thinking, okay, what do you guys, know about what music is doing on a kind of like a biological level, even if it's just kind of a simplified explanation for us.
Mm-hmm. I think my favorite thing about what music does to the brain, and maybe Dr. Webb might have more detail than I on this, but my favorite thing about what music does to the brain is, there's parts of your brain that process vision. There's the vision center of your brain. There's the hearing center of your brain. There's the part of your brain that's involved with, frontal lobe decision making. Music infiltrates all of that. That's what I love about it, is that there's no one part of your brain that's like, oh, there's the music center. It's everywhere. Mm-hmm. And so when one part of your brain gets damaged, music can actually help to form new connections to work with the existing stuff that hasn't been damaged and build new pathways. It's really super cool. That's my favorite thing about music in the brain. Yes, it's everywhere.
So just to elaborate on what Dr. Thomas just said.
Thank you. Yes.
That's really specific. Like, I think specifically of people who've had like traumatic brain injury or a stroke that affects speech.
Yeah.
So the speech center of the brain, okay, I took anatomy a long time ago. I couldn't tell you what side of the brain it's on, the left or right hemisphere. But if the speech center of the brain is damaged in a certain way, the other side of the corresponding side of the brain is music can affect the ability to sing.
Yeah.
So like you may not have lost the ability to sing, even if that person is struggling to speak. They might understand the words that you're telling them, but they can't formulate a coherent response. They call that, I believe, Broca's aphasia. So the part of the brain that deals with singing isn't the part of the brain that deals with speech. So through melodic intonation therapy and therapeutic singing, which is some different mechanisms that some speech therapists use melodic intonation, and then neurologic music therapists use therapeutic singing, you can help someone regain the ability to speak. And they use simple sentences and simple intervals to help people ask questions, make statements, something like things that they would use every day, like, hi, I need water, or my name is Susie. And the intervals would follow some of the patterns of speech. You know, like you go up for a question and you come down when you respond, you know, so and it might seem really simple, like, but it's amazing to see how they can work. And to give you an example of that, it's when I worked with an adult who had dementia back, my first job as a music therapist, he also had bad expressive aphasia, which is the same thing I'm talking about. He could understand what you said to him, but he could not coherently respond. It would be like a jumble.
Yeah.
This gentleman, when I got him in group, he was an older adult, and this was like going back almost 20 years ago. So we would sing songs like On Top of Old Smoky, for example. I didn't know that song had 8 verses, but he could sing all 8 verses. Now, if I asked him to talk to me, he could tell me the first word of the sentence together. I played the song, and he could sing it. So it's fascinating to see how the brain works, that what handles speech doesn't handle singing. And then rhythm. So then there are neurologic music therapists who use what we call rhythmic auditory stimulation to help people whose gaits have been impacted by, like, say, an accident or other brain injury. And it's funny, like, have you ever noticed yourself sitting somewhere, music is playing, but you're not really paying attention, but maybe 10 seconds later, you notice that your finger's tapping, or your foot,
or your head's going.
It's the same thing. Your body, the rhythmic center of your brain, syncs up with what it's hearing outside. So for someone who, and there's videos you can find on YouTube if you type in rhythmic auditory stimulation, there's an image of someone who before the intervention, stumbling to walk, needs assistance, can't really walk, let's say, 50 yards. The music therapist comes in with rhythmic auditory stimulation using guitar, playing very structured rhythmic patterns on the guitar. At the end of the maybe half-hour session, this person is walking unaided, like 30 yards, with limited stumbling. So that it's really fascinating how the brain works. And then, of course, music affects the limbic system, which is the home of your emotions and memories.
Yes.
So that's why when you hear a song, you were like, oh my gosh, I was 15 in the back of my and we were on our way to the mall when this song came on, and all the feelings associated with that come back, all the people who were there come back. So music is integrally tied to our brains. Like, I keep telling people about this and I can never remember the name of it, but like 10 years ago on PBS, Bobby McFerrin and the neuroscientists did a brief series on music and the brain. And they came up with our brains are hardwired for music, because they did all this testing to see which parts of the brain light up when you do certain musical things. And it's all over. It's not to say music is right here in the middle, but this part of the brain in the back lights up, and that part of the brain in the back and the side lights up, suggesting that music is connected to our emotion, the parts of the brain that process emotion, that process memory, that process relationships, that process all over. So I'll stop here, but it gets me excited to think about it.
It is exciting. I think about when I was, just getting started in music therapy, I used to facilitate sessions at skilled nursing facilities, and how often people would notice the phenomena that family members would choose to come and visit their loved one during music therapy, and they would say, this is when my loved one knows who I am. This is when they are most likely to recognize me, because you are playing songs that reorient them back to a time in their life when they knew who I was. And how crucial is that, to be able to have that relationship with your loved one again, But I also think, too, about how music lights up the pleasure centers of our brain. It gives you this rush of dopamine, these feel-good chemicals that other people might get from sex. They might get them from drugs. They might get them from eating. But music, as opposed to those other three, is less likely to land you in a hospital or jail. So we work with people with addictions too, just rewiring. There's so much music can do to rewire your brain and feed it in ways that it needs, that are less destructive than so many other maladaptive coping skills that people might find themselves forced into. Yeah.
It's interesting, because I think a lot of us don't really think about the fact that music can help your brain actually rewire the brain, that it can help, that they can help with the development of brain connections. We think, oh, music just makes us feel good or feel bad, right. but it doesn't, we don't really think about the fact that it can help us build connections in the brain. I mean, it's just, you guys said a lot, and it's been very, it's just so amazing. I mean, just kind of going back, you mentioned the rhythmic auditory kind of stimulation, Dr. Webb, and it reminded me of how we often don't appreciate how much of our experience is sensory. And in my work, I work with a lot of folks that have trauma, and trauma is held in the body. Yes. And a lot of times we do talk therapy, trying to get people to, talk about what happened, but really people felt what happened to them.
Right.
And music has a way of sometimes touching people in that place where they felt what happened. And sometimes that the rhythm engages the body in a way that helps to facilitate them to talk about things or to process what they felt. And we talk about the role of synchronicity in the treatment of trauma as well, just being in sync with another person.
Yes.
So even whether that's dance or drumming, as you mentioned, drumming it's a perfect kind of intervention for, for kids that have a variety of emotional issues, because there's the music, the rhythm, and the synchronicity with other people kind of having to connect that way.
Yeah. And I think there's so much there too in the specificity of Black African diasporic traditions too, about, if you think about how much drumming and dance and movement and music have held us through centuries of oppression. We know this somewhere in our bodies. We know, that it taps into something that connects us to each other in particularly rich and meaningful ways. Yeah.
And did it used to also be communication, right? In the past, in the previous days, that there was communication through music, in addition to, language and kind of words and that sort of thing. People communicated through drumming and through other kinds of music.
Yeah, communication and the retaining of history. I remember once hearing about the Jolly people of West Africa and how they would retain generations of history in song, and how there were people that were trained to know all of these songs, to be able to play them, and how much of a loss it is when one of those people dies. We hold so much musically.
Wow. I didn't even realize how much music kind of infiltrates every area of the brain. Because a lot of times we talk about interventions and they pinpoint specific brain areas. Well, this intervenes in the somatosensory cortex. So this goes there and this goes here. But it's a revelation to know that it really does infiltrate almost every area pretty much.
Pretty much.
And I like also Dr. Webb mentioned about even when people are having that Broca's aphasia, they can't express themselves, they can't talk, that they can actually still sing.
Yes.
That's amazing. That you can still sing even when you can't talk.
Yeah, there's an example of it. I don't know if you remember Gabby Giffords, when she had her traumatic brain injury. There's a clip of a news episode on her where they're watching her with a music therapist, and they were trying to get her to say the word light, and she couldn't say it, and she was getting more and more frustrated. She begins to cry. The therapist starts singing This Little Light of Mine, but she leaves out the word. I think it was that song. And Gabby says it effortlessly. She sings it,
is.
And it's just like, huh?
Like, how does that work? What different part of the brain?
Yeah. Yeah.
Wow. One of the things that I think I'd asked you guys about before is just the rhythm in terms of the biological rhythms, because I think they use music therapy in the Nicu with babies too. Can you talk a little bit about that?
They do. There are different models of music therapy for working in the NICU, and I can't speak to it definitively because I haven't worked in that setting. But the idea is they can use music therapy to support activities that help the baby thrive. So it can help with lowering heart rate if the heart rate is too high. It can help with regulating breathing so that the infants can be in a calm state in homeostasis, so that the body can rest as opposed to being hyper aroused all the time. They can use music therapy to soothe the baby, as I was just saying, but they can also use music therapy to facilitate bonding between infants and parents, because a lot of the times the NICU is a very loud environment. There are lots of machines going on, there's lots of activity, and there are lots of staff present, and parents can sometimes feel a little out of place, but you can use music therapy to help them connect with their baby, even if their baby is in hooked up to different things and needs different kinds of support. So there are ways that music therapy can allow for that to happen, and help them develop like transitional music and transitional practices that they can then take with them when they leave the hospital.
Right. Especially, and it's so valuable now, especially during COVID, when the hospital restrictions on visitors are so tight. If you can have a music therapist who can work with the parents to record their voices and say, this will be played for your baby when you can't be there, so your baby will still recognize you. That's a lifeline for families. Having a child in the NICU is so hard as it is. But now imagine you can't be in there for extended periods of time when you used to be able to. That's a lifeline, to be able to have a recording of your voice and know that my baby will still know who I am, and will still feel connected to me even across distance. And then there are studies that show that when you can do that, you can facilitate that bonding from a distance. When you can help the baby to self-regulate, they go home sooner from the hospital. That's crucial too. They don't have to spend as much time there.
I never even thought about that. That makes total sense, that you'd want to, if you can't be with your child in the NICU during the time of COVID, that you'd want to record your voice, even record yourself singing a lullaby to them, that sort of thing. And then that, when they leave sooner because it is the voice of their parents, and they bond sooner, and that's amazing. So again, for those of you just joining, you're listening to Black Mental Health Matters. I'm Dr. Carryann Williams, and today I'm talking about music therapy. If you want to call in with a question or comment, you can do so at 617-238-7111, or you can follow along on Facebook. The Facebook page is heat981fm.com. And we've been talking about what music therapy is and how it helps the body and the brain. And so I wanted to get into a little bit more about what are the different kind of applications of music therapy. I know we talked about a few of them: autism, dementia. What are some of the other kind of applications that people can think about if they think, I'm not sure if music therapy is helpful in this situation or that situation? Talk a little bit about what it can be used for.
Gosh, it's like a whole host of things, I think.
So many places, yeah.
And I'd like to say you can also use music therapy just to explore your own wellness. And I say that to mean not you don't have to come, I have anxiety, I have depression, I have a physical limitation that I want to address with music therapy. It could be, I want to understand a little bit more about who I am and where I want to go in this life.
Right.
There are different methods of music therapy that can be used. For example, I think of guided imagery and music, particularly the Bonnie method, which is a model of music therapy that allows for a lot of introspective, reflective self-exploration, as well as dealing with things like grief and loss and depression and so on. So people who come to music therapy might be referred because they have some intellectual or cognitive or physical or emotional, psychological need. But you can also come just because I want to know who I am, you know?
Yeah. Yeah, I think especially during this time in the world that it's helpful for people to feel some sense of grounding and connectedness to someone else, and music therapists can help facilitate that for sure. But yeah, like Dr. Webb said, there are so many applications. I've worked in public school systems, I've worked in state facilities, adolescent treatment facilities, community homes, group homes, those types of environments. I mean, there's so many places where you might not think you'd find a music therapist, but you might find one. We're all over the place.
I say from birth to death, you can find a music therapist. Music therapists work in hospice.
They do, yeah.
Music therapists work in nursing homes, addiction treatment facilities, behavioral or psychiatric hospitals, medical hospitals, working with people with cancer, with cardiac issues, burn units in the PICU and the NICU, working in schools with kids and so on, working in community groups, there's a whole host of arenas that you can find music therapy.
And those websites that we mentioned earlier too, musictherapy.org and cbmt.org, can help you find someone near you. And usually, I think through the musictherapy.org, through AMTA's page, they also will list specialties. So you can see, here's someone who's near me and the areas that they specialize in. And that can be really helpful too.
Oh, okay. So many applications. Autism, pain, you talked about pain management as well, dementia, behavioral disorders, substance use disorders, PTSD, and then all kinds of settings: hospice, medical, psychiatric, community groups, and just depending on the reason for it, the session may look different depending on kind of what's going on. So I know as we kind of like wrap up a little bit. I guess, is there anything that people should look for if they say, I'm looking for a music therapist? What should they kind of consider? Like, should they make sure it's somebody that's board certified, or should they make sure that they have some goals, or, what should they think about if they're looking for a music therapist, do you think?
I mean, I think the board certification is definitely a plus if you're looking for someone who has a regulatory body that is looking out to make sure that they're not committing harm. That's always nice. And there are a variety of places where people can get trained and have different sorts of backgrounds in terms of their specialty areas and stuff like that. But I think just as with any other therapist too, that it's about the relationship. Do I feel comfortable with this person? Do I feel like my priorities are taken into account? I think sometimes that can even matter more, especially for Black and brown folks who are marginalized in any way. We know that a lot of these systems can produce harm. So I think wherever you find your music therapist, that, let your instincts guide you a little bit in terms of your comfort and whether or not you feel like your priorities are valued and taken into account.
Yeah, I totally agree with what you said. That makes perfect sense.
And would you, in our last 2 minutes, would you guys encourage other people to go into music therapy, or, is that a field that you feel like, needs more people, needs more people of color, Yeah.
Yes.
Yes.
Definitely. We need more people of color for so many reasons. I mean, particularly, I think of just the perspective on life and the understanding of what it is to be a marginalized person in the society, to work with other people experiencing marginalization can be very validating for those clients, and to know that this is someone who understands and knows my culture, can understand some of what I've gone through, and is not going to dismiss me, not going to, relegate me to the sidelines again, and can bring in music I'm familiar with, can speak to me and relate to me in a manner that I'm familiar with. I think that's so crucial to have more representation within music therapy.
Yeah, and I think too we should shout out the Black Music Therapy Network here too, because you can also find a Black music therapist if you want to find someone specifically within your, racial group as well that blackmtnetwork.org is also a good place to look. And it's also valuable to say for Black and brown folks that may be thinking of entering the profession, anyone, marginalized in any way, that there are communities in the field, there are communities in the profession that are here to provide support and educational resources, because we even talk about this actually in our next episode of Black Creative Healing. With our next guest, we talk about how important it is to prime the space for marginalized people to enter, that it's not enough to say, yeah, come be a music therapist, and then open the door to a room full of sharks, there are people here, there is support here. There is safety can be found here. So I think that's important to state as well.
So I'll be posting the link for your for the Black Music Therapy Network and for your podcast, Black Creative Healing, so that people can check that out. Mm-hmm. You guys are amazing guests. I'm so glad that I had you on the show.
Thanks so much.
I feel like I learned, and I hope that my listeners also learned things as well. And so, guys, thank you so much for listening to Black Mental Health Matters. I'm going to end with a comment from our Facebook user, Sandra, who says, music is love. I like that. That's a perfectly worded statement. Music is love. So, guys, hope you join me next week for Black Mental Health Matters here on 98.1 FM, The Urban Heat at 1 p.m. every Sunday. So take care and have a good week. Bye.
Are you prepared to work? Determined